Welcome to our presentation on the topic of sick leave and the impact that it has on Australian businesses. This presentation has been composed by Madeleine Hill, Marlon Briggs, Meg Tubman, Thomas Hoy and Gabie Madden. We are members of the Monday 5 to 7 p.m. Management 1001 class. This presentation will begin with Meg Tubman providing an introduction and some background information on the topic of sick leave. Following this, we will cover the three main issues mentioned in our case study. Madeleine Hill covers the issue of the culture surrounding sick leave and the entitlement that many workers feel towards taking sick leave. Thomas Hoy speaks about the issue of work overload and stress. And Gabie Madden focuses on the issue of worker dissatisfaction and how this impacts on a business's rate of absenteeism. Concluding the presentation, Marlon Briggs presents some recommendations that can be used to minimise the rate of illegitimate sick days for Australian businesses.
Absenteeism is costing the Australian economy in wages and lost productivity. A survey revealed employees are taking approximately 10 sick days a year, costing employers over $33 billion. The purpose of paid sick leave is to avoid contagious illnesses from entering the workplace and to allow employees to effectively manage their health without incurring any financial losses. Unfortunately, it has become part of Australia's culture for employees to take a day off for non-genuine reasons. For example, Australia Day 2012 cost employers $65 million as employees decided to give themselves an unofficial long weekend. Many employers believe that at least 1/4 of staff absenteeism is for non-genuine reasons. Sick leave and the three key issues, employment morale and business culture, work overload and stress, and worker dissatisfaction, will be discussed in this case study. The relevant theories to address these problems and problem-solving objectives, including the implementation and action plan, will also be assessed. Finally, recommendations will be concluded to as how employers can prevent employees from taking excessive and non-genuine sick leave. The issues identified throughout the sick leave case study includes Australia's culture of chucking a sickie and a lack of flexibility within organisations. The problems involved with employees taking too much sick leave involves employment morale, the culture of the business, workload, stress levels, and worker dissatisfaction. Employment morale and business culture are key issues involved in increased sick leave. Employment morale refers to the worker's job satisfaction, directly relating to productivity. Business culture is the model of how staff communicate and the operations process in place for employees. Work overload and stress are a key issue, causing increased levels of sick leave. Some employees take sick leave when they feel the workload is too heavy and demanding. Many factors contribute to employees becoming overstressed. These include working long hours, overtime, heavy workload, conflicts with other employees. Another key issue impacting levels of sick leave is worker dissatisfaction. Job dissatisfaction is relation to employee negative attitudes in response to how they feel about their current occupation. These negative attitudes may result from a lack of flexibility in the workplace, industrial unrest, or bad job design. Sick leave presents the key issues in employment morale, business culture, work overload and stress, and worker dissatisfaction.
With the average rate of absenteeism in Australian workplaces increasing each year, there is reason to question the legitimacy of the reasons behind the average sick day. It is believed that this increase in absenteeism is partially driven by a sense of entitlement that is possessed by a large proportion of the current Australian workforce. There is a strong relationship between absenteeism and employee entitlement or sickie culture, and this is evident in a study that states that the average number of sick days per year is 20% higher for organisations where there is an existing culture surrounding sick days. With 83% of Australian employers reporting that they believe that up to 25% of staff absenteeism in their organisation is for non-genuine reasons, there is an increase in the need for businesses to introduce strategies to diminish the culture of entitlements surrounding sick leave in their organisation. With staff absenteeism costing Australian businesses $28 billion in lost productivity and wages per year, a number of theories and strategies exist in an attempt to minimise the rising rate of sick days taken by the average Australian worker. There is a number of workplace practices that can be implemented to facilitate a change in the attitude towards sick leave and minimise the prevalence of a sickie culture in the modern day workplace. In 2008, the Victorian State Government introduced the Work Health Program to promote employee health and wellbeing as a key to successful business efficiency and success, and provided more than 800,000 free health checkups for workers. This program assists in minimising the likelihood of legitimate sick days while additionally serving as a prevention strategy to deter employees from feeling entitled to take illegitimate sick days. Providing employees with a detailed sick leave policy is a strategy that allows all staff members to be aware of exactly what they are entitled to and can deter them from abusing these entitlements. Some sick leave policies require that employees provide an official medical certificate to explain why they missed a day at work, but problems can arise when employers and employees feel that this is a breach of their mutual trust and honesty, which is inconsistent with the goal of improving workplace culture. Minimising the prevalence of the culture surrounding sick days in Australia can be addressed by programs that focus on the employee's rehabilitation and return to work following an illness or injury. Implementing such strategies that focus on the employee's health and well-being allows employees to feel more supported when they are generally unwell and will ultimately discourage employees from abusing their sick leave entitlements. Illegitimate absenteeism is becoming a common issue for the modern-day workplace, with a negative impact on efficiency, worker morale, and overall culture of the workplace, with the concern of dishonesty, resentment, and destruction of trust among workers. There is a number of workplace practices that can be implemented to facilitate a change in the attitude towards sick leave and minimise the prevalence of the sickie culture in the modern-day workplace. These practices involve providing employees with a clear sick leave policy, detailing exactly what they are and are not entitled to, educating employees on the implications that arise from employees exploiting their sick leave entitlements in terms of cost, efficiency, and workplace relations, highlighting the issue of workplace trust, respect, and honesty, and the implications that illegitimate sick days can have on workplace morale and culture, consistently reminding employees about the organisation's sick leave policy via email or newsletters to ensure that staff members are aware of their entitlements, providing employees with access to adequate health care for when they are legitimately unwell to avoid their illness or injury from worsening and facilitate their recovery, and employees and managers should lead by example and take sick leave when they are unwell to facilitate a good workplace culture surrounding sick leave and when it is appropriate.
The issue of work overload and stress within the workplace can be seen to be a key factor in contributing to the amount of absenteeism and sick leave that a person may take. This issue of stress can be defined as a state of mental or emotional strain or tension resulting from adverse or demanding circumstances and may affect anyone at any time in their lives, but can be most commonly associated in a business context. There are many different factors that may cause a person to become so overwhelmed and stressed that they burn out and need to have a sickie. Some of these factors include working long hours and overtime, heavy workloads, and conflicts with co-workers or superiors. These factors can often extend from poor management and communication with employees, causing managers to neglect their employees and ultimately create a more stressful work environment. One study published in 2010 titled "Burnout as a Predictor of Medically Certified Sick Leave Absences and Their Diagnosed Causes" looked at over 3,900 industrial employees between 1995 and 1998 that had medically certified sick leave, and found that almost 51% of these employees had taken sick leave due to stress-induced burnout. This burnout can be defined as a combination of exhaustion, cynicism, and a lack of professional efficacy, and was even found to increase the risk of future absences due to behavioural issues and mental illness. To help reduce stress and lower the level of unnecessary absenteeism in the workplace, constructive action must be taken by managers and leaders within organisations. One behavioural scientist, Dr. Peter Cotton, believes the best way to reduce stress is for managers to sanction doona days for employees, giving workers the option to have a few unexplained days off work each year for times when they simply don't feel like coming to work, which would in turn result in less sickies and unexplained days off work in theory. Ideally, the most effective way to reduce stress-induced sick leave within the workplace would be for managers to adapt or change their management styles to help employees dealing with workplace-related stress. The key to doing this will be through managers improving communication and interpersonal skills, helping them to interact more with their employees. In this case, the conflict management style of collaboration would be useful, as it is able to be both cooperative and assertive, satisfying everyone's concerns by solving issues in a way so that everyone gains and nobody is negatively affected by the outcome. Improving communication channels may also be a solution to reducing stress-related sick leave, as a higher richness communication channel allows managers to constantly engage with their employees on a face-to-face basis. These two strategies would allow managers to ensure workloads are distributed evenly, conflicts are resolved quickly, and would also allow managers to learn of other issues that employees may be having outside of the workplace. If these strategies were implemented by managers, employee stress would be successfully reduced, resulting in less sick leave and a more relaxed and calm work environment.
Job dissatisfaction caused by poor management is a key issue relating to the high levels of sick leave absences recorded in Australia. Job dissatisfaction is in relation to an employee's negative attitudes in response to how they feel about their current occupation. According to the new direct report by Direct Health Services, in which there were 200,000 participants surveyed, 36,000 participants reported taking a sickie due to poor management. Poor management may include the factor of inflexibility in the workplace, where employees take a sickie instead of being granted 2 hours leave to attend an appointment, for example. Peter Wilson, National President of the Australian Human Resources Institute, has research that indicates high levels of sick leave absenteeism could indeed be directly related to issues within the organisation, for example, industrial unrest or bad job design. Control through feedback as a theory would be extremely beneficial in taking corrective action in fixing poor management styles. Feedback from employees through quarterly surveys on job satisfaction regarding how management handle industrial disputes, leave requests, and the day-to-day running of the business will provide the management team with explicit information on how they can improve to ensure their employees are satisfied. A strategic objective to apply to this theory would be the 4 steps in the control process: establishing performance objectives, measuring actual performance, comparing results with objectives, and taking necessary action to resolve problems or explore opportunities. By management implementing the control process for each task, their behaviour and performance can be measured, so when feedback results are returned, the management team can evaluate which element of the process they are not pleasing their staff with. By knowing what they are doing wrong and where in the process, the management team can adjust and improve in that area rather than completely having to remodel how their business is currently running. The action plan is long-term and aims to reduce job dissatisfaction with the goal of reducing sick leave absenteeism. There is to be quarterly feedback surveys to monitor employee satisfaction and half-yearly audits done by external companies to ensure that the management team are hereby adjusting to employee requests to a certain extent. The audits will also examine whether this process is effective by comparing the sick leave absentee numbers by each audit. The responsibility includes all employees and management, and the resources required will be time and money. It is highly recommended that the businesses with high absenteeism due to sick leave re-evaluate their management team and ensure that their employees are satisfied with the business operations.
It is therefore clear that absenteeism in the workplace because of non-genuine sick leave is costing Australian businesses unnecessary high expenses. The entitlement mentality or the sickie culture created by Australian employees induced stress as a result of work overload and job dissatisfaction are the key issues revolving around the high rates of absenteeism. From the research gathered, it is clear that this problem could be addressed through business management. Business management need to assess their current sick leave absentee levels and then implement ways of monitoring and controlling the amount of illegitimate sick leave and improving the well-being of employees. This in turn will create an improved business culture, efficiency in the workplace and worker satisfaction through reduced stress and motivation to complete tasks. For Australian businesses to reduce and control the amount of sick leave absentees in the workplace, they should adopt the following strategies. During workplace orientation, a well-defined sick leave policy will be read and signed by all employees. This will allow for a clear understanding of all entitlements and the consequences of breaching this policy. For part of the policy, a medical certificate is required to be presented to the Human Resources Department for each day that the employee is not at work. Training and development days for all employees. These training and development days will focus on how to handle workplace stress, time management skills, and the importance of work-life balance. Highlight through monthly staff meetings the importance of trust, respect, and honesty on workplace culture and how taking illegitimate sick leave can impact on future relationships between employees and employers. Providing employees with access to adequate health care for when they are legitimately unwell to avoid their illness or injury from worsening and facilitate recovery. The implementation of gaining feedback from employees about job satisfaction. This should be done through quarterly surveys and interviews. The information gathered can help business management improve their procedures and workplace culture so employees are more willing to come to work and be efficient. Have external companies complete an audit on sick leave rates as well as business management styles to ensure that the business is accommodating the employees' request for change. Training and development days for business managers. It is through these days that they will learn to adopt more effective ways of communication. The improvement of interpersonal skills will allow for a more collaborative workplace and for managers to have skills that recognise stress and inconsistency in employees. With these skills, managers can address the issue and assist the employee with stress management. The business should have an available counsellor for employees to use if they need to speak to someone confidentially.